Hey, it's all yours.
Okay. Well, so nice to see all of you today. My name is Heather Suri. I am a registered nurse and I'm also a credentialed aging life care manager. And I own a group practice serving all of Northern Virginia. My offices are in Chantilly. And today I'm going to talk to you a little bit about what is an aging life care manager? A lot of people don't even know about this distinct profession and a little bit about what people like us do and where to find one. So I'm going to share my screen because I have some uh, kind of brief slides to help me stay on track today. So, aging life care management, and you'll see down here on the bottom of the screen, the Aging Life Care Association. That's an important take home today as you're looking for a professional to work with. I strongly recommend that you find someone who is a member of the Aging Life Care Association. Care managers, it's not a protected title like a registered nurse is. We're not care managers don't have a specific licensing body. And so the way that we can ensure that consumers are going to have access to somebody with the educational and professional background, that so you can be pretty confident they know what they're doing, is that membership with our professional association. So what are aging life care managers? You might have heard the term geriatric care managers. We That was more widely used probably 10 or 15 years ago. We moved away from that language because nobody particularly likes the word geriatric. When I was in, my 36 and having my last child, and they told me I was a had a geriatric pregnancy. That didn't feel like a happy word to me. And we also aging life care professionals or aging life care managers. A lot of us work with people across the lifespan. So I am working with people who had strokes in their 50s or adults with disabilities who certainly don't identify as geriatric. So that's why we use that term aging life care, because it more accurately represents people across the lifespan. So, what kind of people do this work? This profession of aging life care management's been around about 40 years or so. It was founded by social workers and largely social workers who were at the end of their career and tired of all the bureaucracy and just wanted to work with people in a more person-centered way. And then we kind of moved into being kind of nationally half nurses, half social workers. Nursing is my background. But these days, we are seeing people come from a variety of different health and human services backgrounds. And even though we all do care management, we bring our unique educational and professional backgrounds to the work. So, my team is pretty diverse in terms of background, but I'm seeing that across the board in the community. So we have nurses and social workers. I've got speech language pathologists. I have two OTs. I have dementia specialists. I had a pharmacist at one point. I've had a physician's assistant on my team, but we all do care management. But these are the kinds of backgrounds that we come with. And those two good-looking folks are two members of my team, Carrie, who's an RN, and Herbie, who is a social worker. So care management is unique in that it's a very holistic practice. So care managers have a really broad knowledge base, and we have high levels of expertise in these eight knowledge areas for sure, and sometimes beyond. So certainly the health and disability is a big one. especially for our practice and being kind of nurse owned. We have a lot of knowledge about the different chronic illnesses that people are struggling with through aging, a lot of knowledge about how to navigate the healthcare system, which doctors are the best at certain things, and how all of these different kind of healthcare services come together. It's incredibly fragmented, especially for older adults. And so, we have deep knowledge about kind of how to help build that team. The financial piece, people don't always realize that we have a lot of knowledge about the financial piece. We're not financial advisors, but we know enough to know kind of how to help you come up with the right questions for your own financial advisor. We are finding that a lot of the advisors, when they're doing projections for, you know, um, looking at how to make sure that your financial resources are able to support you through the end of your life, that what it's going to take, what care costs. And a lot of times they're using outdated national averages that don't reflect what care does cost locally. And so that's something that is on our radar. So we're giving you really good information to take back to your advisors. Or for some folks that we're working with, we know that Medicaid will probably be part of the plan for how to access care in the future. So we're helping people prepared for that and getting them in with elder law attorneys or Medicaid planners, or just offering some general high-level advice, so that they're not getting into trouble with the 5-year look back for Medicaid and that type of thing. So we have a lot of knowledge about the financial aspects of aging. Same with housing. We're working with a lot of folks who are trying to figure out, maybe they've decided to downsize and need to understand how different families do this. What are the options? What are some of the things that you should be thinking about, those considerations before you're making some of those pretty high stakes financial decisions about a move. So again, our job as care managers is to make sure that you have really high quality information to make informed decisions for yourself, to hopefully prevent um, costly mistakes because you didn't know what you didn't know. So definitely know about the housing resources. And one thing that I think is important to add here, and I'll touch on this a couple of times as we talk. Aging Life Care managers, members of this Aging Life Care Association, we have a code of ethics that prohibits us from having any kind of financial relationship with anyone we refer or recommend. So if somebody's looking for senior living, or they're looking for financial advisor, or they're looking for an attorney, we can't accept any kickbacks. We're not getting compensated by anyone we refer you to. And that's to ensure that our recommendations are unbiased and really ones that we're making that we think are a good match for you based on our assessment. And then also, because we're working in the community, we're seeing who's good at what. And so we're referring you to people that are already vetted and we know provide quality services. We work a lot with families in so many different ways. It might be where we might be working with an older adult, and maybe there are adult children who have different perspectives on how things should be. A common one that happens is maybe an adult kid feels like parents should be moving into a senior living community because they're worried about the crisis that might happen. And so sometimes it's helping to provide some support and information to the adult child about you know, quality of life and the timeline and honoring their parents' autonomy and not letting their anxiety get the best of them. Sometimes we're working with someone who does have a chronic illness or a progressive disease, and maybe we have a caregiving spouse who needs some support to figure out how to make sure their own needs are getting met and the planning for their future is happening alongside the planning for the spouse that needs more help immediately. So we do, really look at family systems and not just the individual because none of us are aging in a vacuum. The decisions that get made reverberate and impact our whole family systems a lot of times. We have deep expertise in all of the local resources and this can be it's important for people to know like what they can squeeze out of the insurance company. So when we're working with a family, we're always trying to make sure that people are able to take advantage of the insurance covered services that are offered, at that county level, things that are going to be, have less out of pocket expense first, that we're making sure people are educated on those options. And then what else is out there? There's a lot of very kind of unique or niche services that sometimes people don't even know they exist. One that comes up a lot. I don't know if anyone on the call has had the opportunity to use Dispatch Health yet, but I still talk to groups often that haven't used them, and it's a mobile urgent care that's covered by insurance. And so a lot of times when we'll have families who, maybe they've got something going on and it's 4 o'clock on a Friday and they can't get in with their PCP and they're kind of grappling with, oh gosh, the only other option is the emergency room. Nobody wants to go to the emergency room on a Friday evening if they can avoid it. And so Dispatch Health is a fantastic resource that a lot of people don't know about. That's not a concierge resource. It's covered by insurance. So um, all of those kind of odds and ends that can really help people successfully, age in place with less stress. That's an area of expertise for us. We serve as professional advocates, in and out of medical spaces, but we work with a lot of people who feel like they're retired, but their new part-time job is going to medical appointments because they're seeing a specialist almost every week, and the specialists aren't communicating with each other or with the primary care, and they're not feeling like their medical care is well coordinated, or they feel rushed, or like they're not getting the answers that they need. So because we have spent our careers working in the healthcare systems. We know the back doors. We know the tips and the tricks to make sure that you're getting the best care possible and how to kind of herd those cats in the healthcare system to advocate. Or we'll have people who go into hospitals, or maybe they are on a rehab stay doing inpatient rehab at a skilled nursing facility, which can be really frustrating, with some of the staffing and some of those experiences. So we know what families go through when they're in those situations and can just step in and offer people really helpful guidance and advice. And sometimes for families, we're helping know what questions to ask or what to insist upon. Some families may engage us to actually come in and have those conversations directly with the providers. So we work with each family a little bit differently depending on what they need and want from us. We have a lot of knowledge about the legal aspects of aging, how to guide someone. When do you see an estate attorney or when do you need an elder law attorney? What's the difference between the two? How do you know that you're talking to the right professional? Helping people. People often do this estate planning, and they've got trusts and they've got powers of attorney and they've got wills and advanced medical directives, but maybe people haven't looked at those since they wrote them 10, 15, 20 more years ago. So we like to dust those off and sit down with people and make sure that they still make sense. And perhaps they were written up in another state and things have changed. So helping people get connected with the right professionals to update those. One of the things we see really commonly is maybe the powers of attorney were drawn up many, many years ago, but maybe one of the spouses now has a cognitive diagnosis. And so maybe we need to make a change because where they were once legal decision makers for the other, maybe we need to bring somebody else in the mix so that everybody has kind of the coverage and the backup that they need. So we can provide some guidance and some help with that. And then, of course, the crisis intervention. We get a lot of folks who call us because they're experiencing a crisis. Maybe they have a new diagnosis. We see that a lot, especially with cognitive diagnoses, or sometimes a diagnosis of Parkinson's is another one we work with a lot. So you go see your neurologist, and your neurologist says, "Okay, here's your diagnosis, here's your prescription. See you later." And the world has kind of turned upside down. There's all of these resources that are out in the community that the doctors, they might not know about, or they just don't have the time to sit down and really talk with their patients about how does this impact life, and how do we live well with this diagnosis, and what do you need? And so we people come to us there. They come to us because they're in the hospital, and the hospital discharge planner just said, well, you need to go to a skilled nursing facility to do rehab, and Medicare is going to pay for it. And here's a list of 5 places. Let me know by lunchtime which one you want to go to. And those discharges happen so quickly that families, it's not like there's time to go and tour and see where you want to go. And so that's something where we know the ins and outs of all of these places. So we can, quickly help people sort that list, into a first, second, and third choice, and help people know what to expect and how to avoid some of the common pitfalls. Sometimes we have folks who things aren't working at home. Maybe again, in this scenario where we have someone who has a caregiving spouse, and maybe something happens to the caregiving spouse. They have a medical emergency and up in the hospital. And then we have somebody who needs help at home. And where do we start to kind of get everybody taken care of? So you can see it's a lot more than just, the health things. We really have to see how all of these moving parts go together. So I've talked a little bit as we went through the knowledge base about what we do, but kind of brass tacks. Sometimes we go in and maybe things, nobody's in crisis, but you want to do some talking and planning for the future. Maybe there's some right now needs, but we're also concerned about what kind of might be coming down the pike, and what do we need to prepare for, and what should we be thinking about. So we might work with those families just by doing an assessment of the current situation, and help with some planning for the future, so people feel empowered with good information to make decisions for themselves and their aging. We do kind of one-off consultations. Sometimes people might just schedule to come see me in the office, or we do a virtual meeting for an hour and we talk through whatever somebody wants to talk through. Sometimes I talked with a family yesterday because they were saying, okay, is my spouse still safe to drive? Like sometimes we think it is, and sometimes we think somebody's not. And how do people make these decisions? Because when you ask the doctors don't ever want to be the one to say someone can't drive anymore, because then their patient's mad at them and they don't want their patient to be mad at them. So it can be hard for families to kind of navigate how to make some of these decisions, or maybe somebody wants to talk about downsizing, but they feel overwhelmed about, how do we, I talked with another family yesterday, married 61 years and had 61 years worth of stuff in their house and was just really overwhelmed with where to start. They knew they wanted to downsize, but were having a hard time getting started. Or sometimes somebody will come in with a new diagnosis and just wants all the resources. What are all the resources that can help us right now with this new diagnosis? So those sometimes we do those consultations and then people go on and use that guidance and we don't hear back from them. We talked a little bit about crisis intervention and the advocacy, um, education and coaching, for might be for adult children, might be for someone who's struggling with communication, particularly if there's a cognitive diagnosis, figuring out how to best help their partner or their spouse. Um, the care team building, I think, is an important one. So when something happens, there's a change in condition, or maybe somebody is coming out of the hospital and recovering, all of a sudden there's this flurry of activity, and maybe there's a home health company coming in that the hospital may have even set that up. And so there's a visiting nurse that's coming, and maybe an occupational therapist and a physical therapist, and then maybe somebody needs a little bit of home care or a lot of bit of home care, and you Google home care, and there's, 500 companies in Northern Virginia to choose from. And, maybe there's something else going on. Maybe somebody in the hospital has mentioned that, a palliative care provider might help with some symptom management, or you need to follow up with a urologist and a neurologist, and who do you see? So, we really know in the community who's good at what, and in some cases can help you navigate. Maybe we know of a neurologist that is not the closest one, but the next closest one you can get in sooner because, we know that their schedule isn't full. So we often have some information in our back pocket that can help facilitate you building your care team. And then of course, we'll connect you with all the good stuff out there. Um, Coming back to the Aging Life Care Association and why that matters. Um, really for me, it comes down to, we have a published standards of practice you can find on the website, and there's a code of ethics. And we take it very seriously. I'm actually sit on the National Professional Practice, Professional Conduct Review Committee. So there is consumers can file a complaint. And if they felt like standards weren't followed, or a member did not conduct themselves professionally or ethically, and we do review those cases in detail. So I think it offers some consumer protection. It's, again, care manager, anybody can call themselves a care manager. And we do see people moving into this space that don't have the education or the background to do the work well. So looking for that Aging Life Care logo on their website or asking them if they're a member will, you know, give you a better chance of working with someone well. And the referral fees, I think that's a really important one because there are business models out there. I mean, everybody's heard of A Place for Mom. That's, the reason why that service is free is because A Place for Mom is taking money from the companies that they recommend to you. And there are a lot of business models that are not the big national ones like A Place for Mom, but are franchises or even local businesses. And that's, while different business models, they all have their place. What concerns us about that is that there's just inherent bias involved in that those companies may only introduce you to companies that they have a contract with. So it's not really giving all of the options, and they are incentivized by that compensation and not necessarily by what is best for you. So aging life care professionals, we work for our clients and are accountable only to them. So this is where you find us at aginglifecare.org. You can do a zip code search and find members of the Aging Life Care Association, and we're all over the country. So there's probably, I think, about 1,800 of us that are members. I've been the president of the Mid-Atlantic chapter of the Aging Life Care Association. I've been on the board now of the Mid-Atlantic chapter for 8 years and sit on national committees. And I just feel like it's a very important organization, especially as I mean, I've noticed just in the last year, all of the new companies that are coming up to sell things to older adults. The industry has gotten the memo that we have a lot of this generation of baby boomers that are coming in. Everybody's trying to sell you something. And so I think that people like us can cut through some of that noise and help you get what you need and not be taken advantage of. And my practice is called Pathways in Aging, but we have a lot of really fantastic practices in the Northern Virginia area. I've got some fantastic colleagues who do really great work. So again, that aginglifecare.org is a great way to find someone like me. And I would be happy to answer any questions.
All right. Well, we've got a couple of questions on how much a care manager costs and how you get paid. Does
Yep.
insurance cover any of it, or is it all out of pocket?
Yep, that is a great question. So, health insurance, like Medicare, or your health insurance, pays for none of this. I actually have one of my staff, Herbie, he was in the picture, is a member of our professional association's public policy committee, and he's in DC today. We are constantly having these conversations, wishing that Medicare would help cover what we do because we think we can prevent crises and keep people out of the hospital and we could save Medicare money. But so far, no deal on that. Long-term care insurance, if you have a long-term care insurance policy, a lot of those do have some coverage for care managers. They call it different things in different policies, care coordination sometimes, but the LTC Feds, Genworth, John Hancock. I'm a big fan of helping people get their money's worth out of those policies. So we've been able to get reimbursement for our services from a lot of those policies. But outside of that, it is an out-of-pocket cost. In this area, I've seen fees range from about 180 an hour to around 250 an hour. So, similar to, and most of us bill similar to an attorney in either tenths of an hour or quarters of an hour. Um, but again, we're working in, though we do hands-on things. There are folks that we might take to a medical appointment and advocate for them there, take good notes, make sure all of the follow-ups happen. But a lot of the work that we're doing looks a little bit more like consulting behind the scenes, just making sure that you've got that expertise on tap.
If somebody engages a care manager, is there a minimum number of hours that they are expected to use, or is it strictly, pay as you go?
So we're all small businesses, so I can't speak for all of the small businesses, but in general, I can say for my practice, for most of our clients, we like to see them once a month, if they're requiring active care management services. We have another program, and I know other practices locally, for folks who might not have immediate needs, but we have a program called Plan Ahead. Where we meet with people more like kind of twice a year, to make sure that our charts stay updated so that if something happens, we can kind of jump in. But it's not like home care where, they want 4 hours at a time, 4 consecutive hours in a day. So, um, yeah.
Okay, you talked a bit about financial expertise. Can you elaborate a little bit on what you would do and how that would come to bear?
Yeah, so I think because we are well versed on costs of care, so we know what home care costs. We know that have a sense of how care needs increase over time. We know what senior living costs at the different places and at the different levels. So, kind of that high level planning, if we understand what someone's income and assets are, then we can provide some of that high level guidance with, okay, well, if we get to the place where we're needing 8 hours of home care in a day, then, maybe we need to start thinking about senior living if we're looking at it just through that financial lens. Like where is that time where, from a cost perspective, this is going to become unsustainable at home. Or, maybe we're looking at someone that we think that maybe Medicaid may be needed based on, what their kind of assets or their availability, access to funds for long-term care are going to look like. So how do we delay that timeline as much as possible? What are ways, because home care can be very expensive. So are there different tech solutions we can implement to provide some support, some oversight, so that the home care costs are kind of kept at bay, and we can extend this timeline when we need to think about Medicaid. So it really is more about that high level planning. And then, there are some people that I don't know how many of you have heard of the Life Care Affordability Plan. So that's kind of a standalone financial advisement product that is really helpful for folks as they're trying, especially when we have a couple and we have different care needs, and their projections are much more accurate than what we're seeing most of the advisors offer, that can help people make informed decisions about what care they can afford. Because a lot of times we see people so worried that they can't afford it that they're actually not getting the care that they need. And if they're not getting the care that they need, they're more likely to have a crisis, which then changes everything, right, about where they can receive care. So it's a we provide high level guidance that can help people with planning and then get people connected with the right advisors. Are you working with an advisor that is a fiduciary? Somebody who really is required to keep your best interests at the center of the planning versus what's going to make them the most money on the backside. So just making sure you have good options.
This person says they know of an ANV member who had a great conversation with a care manager when she was trying to decide her future living options. And can you talk about that assessment phase? And I want to add to that, if somebody comes to you with a list of, rehab facilities or continuing care facilities, are you guys able to look at that list and go, do not go to this place, period, full stop, under any circumstances? Or are you
We
kind of
are.
restricted? Okay.
Because we don't take money from Medicare. So the reason why when you're in the hospital, the hospital social worker, the discharge planner, can't tell you, "Ooh, don't go there." They're not allowed to provide any opinions. They can only provide you a list. We can give you opinions all day long. People hire us for our opinions because we're in and out of these communities, and we know the strengths and weaknesses. And the truth is, I'll breaking news, none of them are great. They're all short-staffed. Some of the skilled nursing facilities that are in the CCRCs, like Goodwin, for example, tend to be better, but it's really hard if you don't already live at Goodwin, to do your Medicare covered rehab stay there because they're usually, the people in their own community are doing their Medicare rehab stays there, so they almost never have an empty bed. But we use other criteria based on someone's specific situation to make recommendations. And the same with assisted living or memory care. No place is perfect, but we know who has had, three directors of nursing in the last year because they've just, they're having a hard time getting it together and they're having all of this turnover, or who's had a stable staff, or who, doesn't have a very fancy looking building, but has really high quality care. So, we can, again, have a lot of that inside information.
You've talked a number of times about working with families. Do you help seniors who don't have any family develop the supports they need, especially as it relates to cognitive decline or end of life care?
We do. Yeah. Yeah. And when I talk about families, I'm talking about families of origin and families of choice. But when we have folks who are solo agers and don't have a community, then yes, we're trying to get them set up in the best way possible. For some clients, I actually serve as the healthcare power of attorney. And I am also able to serve as a court-appointed guardian for some folks. I personally don't do the financial side, so I don't serve as a financial power of attorney. If someone doesn't have someone to do that, then I have recommendations I can make of companies that I partner with. But yeah, and I think all of us, all of care managers, we often work with solo agers because they need that advocacy and that planning piece if they don't have a broader network.
How many clients do the people in your team have? I mean, how overworked are you guys?
So we try to keep it sane. Again, speaking for my practice, I have found that our care managers, about 20 Not more than 20 is about right because we need to be able to be responsive if one of our clients has been at home and doing well, and then somebody had a fall and, broke a hip or got a pneumonia and had to go into hospital or something like that. We want to be able to respond quickly and do what needs to be done. So we usually assign not more than 20. And my practice, the care managers work in kind of dedicated geographic areas so that we're not, going between Leesburg and Alexandria. That the care managers are just really working in depth in their areas. But that seems, and even then, we go through kind of waves of time when all of a sudden everything feels like it's on fire. But for the most part, I my employees are salaried. Um, and they're all members of the Aging Life Care Association. And we work hard on making sure that there's good work-life balance there because people in these types of professions are at high risk for burning out. And we want people to stay with the practice um, but yeah, it's I mean I'm a little biased because I hired them all, but we've got some pretty special people working with us. You can see them all on my website.
When is a good time, or is there a good time for someone to consider engaging your services?
So, I think we like to start working with people before a crisis because if we have an opportunity, and that's actually why we started our Plan Ahead program, um, because as we were getting out and doing talks like this over the years, people would come to us and say, "Well, I don't need you right now, but." What if something happened and I needed you, in the future? And so that Plan Ahead program allows us to get to know people through those meetings, like quarterly or twice a year, what you want, what you don't want, what's important to you, what your values are, and then also that high level information about who are your people, who are your legal decision makers, which neighbor in on your street, has your house key if you're in the hospital and I need to bring you, a fresh set of clothes. How do we get into your house? What is your big picture financial situation? If you need care, are we hiring care to put in the home, or do we need to look at a different option? So the more of those discussions we can have in advance, then people aren't in this situation where they've got to make really critical decisions quickly in the middle of a crisis. None of us do our best decision making when we're in the middle of a crisis. So we love to get to people early. But other than that, I think that if you're feeling overwhelmed or you're having trouble, getting answers to your questions, you're feeling a little dissatisfied with your medical care, or you're not even quite sure what you need, but things aren't working. We start almost everybody with a consultation. And if we can't fix it for you with an hour of discussion and answering your questions and giving you resources, then it may make sense to engage us to work on some of those pieces. And sometimes we're working with people kind of short term to get through a crisis. I have other folks I've been working with for many, many years. So it's with each individual, it's different.
Do you ever have people come in for a consultation and at the end of it you say, you know what, you've got this under control. You don't need us now. Come back in a year or watch out for this, this, and this. And if you see
Mhm.
those red flags, then come back and talk to us.
All the time, all the time. The one of the things that's really a core part of our practice is the financial transparency and making sure that our services are bringing value for the cost. If there is, I've had people call before and wanting to engage us. And as we were talking through the problems, what they needed was a companion, somebody to maybe help them get to medical appointments because they were having trouble with transportation and helping them pick up their medicine or helping them, go through their stuff and get things packed. We don't. An excellent companion could be somewhere between 45 and $60 an hour. There's not a reason to pay somebody like us if that's all that's needed. So, our job again is to make sure that you have the right resources um, for what you need. And I have some people who just schedule a consultation with me when they need it. And so maybe I'll touch base with them. They for my practice, people can book it right on the website, so they can see my calendar and book that hour and either come into the office or we do it virtually. And that they're working on the things themselves. They don't want help with that part, but they want the guidance and the advice.
Where is your office?
My office is in Chantilly.
Okay. All right. Anybody else have any more questions? If not, I was going to say I'm curious about your logo and what the
Yeah.
little, why the LI is different from the rest of Life Care Association.
Oh, yeah, I think they were trying to be cute. I think it's like a little emoji, like a little smile.
Okay.
I think they were trying to be modern. That wasn't my design, though I don't know if I could have done a better job. But I think that really, and I think this is true in a lot of healthcare that we're especially as we're working with older adults, trying to move away from this disability model of thinking, and really trying to shift the focus on how do we help people live well and age well. It's tricky because the insurance company, basically dictate our entire healthcare system, and it's very focused on disability because that's what the insurance company with the what the doctors get reimbursed for. As a nurse, we're trained in what are people's limitations, what can't they do, what do they need help with. So I think that as an industry, we're trying to reframe some of that language, and the way that we talk about aging to say, okay, people have strengths or weaknesses. We all have strengths and weaknesses. How do we set life up to play to our strengths and give us a little support in the places we need help?
Well, do you have any advice for us, given what you just said? How do
So
we?
my advice that I give everyone is look at your legal documents. This is so, so, so important. You need to make sure that your legal documents have somebody that you trust to make decisions when you can't, because we don't know when you won't be able to. All of my kids, when they turn 18, we do the power of attorney things for them because anything could happen at any time, and everybody needs to have a legal decision maker in their corner. So that's really important. If you have adult children, do it as a gift for them. It'll make life so much easier for them if you have a crisis and they need to step in, if they have the tools that they need to get it done. It's very hard on the adult kids. They're in the workforce, they're raising kids of their own, and when an aging parent has a crisis, it's and they're having to jump through hoops and argue with doctors and argue with financial institutions and can't get what they need. It's really stressful. And then the other piece too. really encouraging everyone to have those difficult and awkward conversations with your decision makers, with, whoever that is, your kids, your friends, your spouse, about what you do and don't want around end of life care. Nobody likes to talk about it, but it's going to happen to all of us. And it is so much easier for your person to carry out your wishes than it is to have to make decisions for you. And so it's a way too, I think, for us as individuals to kind of retain some control. People don't want to talk about these things or do the documents because it feels like giving up control, but really it's the opposite. It's a way for you to ensure that what's important to you, what matters to you, is documented so that the rest of us can do what you would want done, instead of doing what we think is best. So yeah, I know it's a downer. No, nobody gets excited when I talk about it, but it really is so important.
All right. Well, it's 2 minutes to 11. So if anybody's got one last burning question, now's the time. Otherwise, I'm going to put Carolyn on the spot about what our next conversation is going to be. You're on mute, Carolyn.
Thanks, everyone.
Carolyn, you're on mute.
You would think by now I would have realized you're going to do this to me every week, but no, I don't know what the next conversation is. So um, let me see if I can pull it up quickly.
It's in the
Next
chat.
week is
It's in
going
the
to
chat.
be
It's in
Liz,
the
do you have
chat.
it?
Yes, it's in the chat.
Ah, all righty.
And it is going to be about the Mormon temple. Basically, Briggs Horman will speak about the temple and talk about its history, and it should be interesting.
Um, I'm not sure about that. I think that's the one on the 15th. I think
Oh,
the 8th may
sorry.
be end of life doulas.
Oh, I got it confused. I'm sorry.
No, it's okay. If you look at, for me, if I look at the newsletter enough, I'll have it in my head. But I'm pretty sure it's end of life doulas. So somewhat related to how Heather ended her conversation today.
Yeah.
Yep. All right. Well, I think we all learned a lot today, and I found it very interesting. And I guess we'll all come back next week to learn about how to end it all
Right.
as comfortably as possible. All right. See you all
Thank
next week.
you.
Thank you. Thank you, Heather.